This is pharmacist and clinical nutritionist John Prexshot bringing you another edition of Nutritional Notes. Today, I will be talking about nutritional support for brain health. The ever increasing incidence of Alzheimer's disease is a concern shared by most Americans. The actual cause of Alzheimer's disease is unknown, but what we do know is that the development of Alzheimer's disease begins decades before actual Alzheimer's symptoms are present. Brain inflammation, the development of plaque in the brain, decreasing numbers of essential brain chemicals, and decreasing blood circulation in the brain are all viewed as factors that can lead to the onset of Alzheimer's and cognitive decline. A diet consisting of processed foods and fast foods with too much sugar and saturated fat has been shown to clog our blood vessels, impair blood circulation in the brain, and create the foundation for not only impaired cognitive function, but diabetes as well. A lifestyle that consists of high levels of stress with constant multitasking have also been shown to increase the loss of brain function. However, a good exercise program, along with adequate sleep, helps to keep our brain oxygenated and fully functioning. Staying active mentally, but not multitasking, has been shown to be of value when attempting to prevent brain decline. Remember, the inability to focus and remember is not limited to Alzheimer's patients solely. Similar brain impairment can also be found in adolescents diagnosed with attention deficit disorder, and in those individuals who tend to have too much mental work on their plate, such as college students or those attempting to juggle both the challenges of maintaining a job and pursuing an academic degree. Some nutritional supplements have been shown to be helpful in the prevention of brain breakdown and the overall support of brain health. The essential fatty acid DHA, which is found in fish oil, provides anti-inflammatory activity in the brain tissue and helps to protect the covering of brain cells. Acetyl L-carnitine has been shown to have a valuable role in brain health. Acetyl L-carnitine helps to increase brain health by increasing the production of important brain chemicals, which serve as the message senders in the brain, particularly the main message sender in the brain, acetylcholine. Phosphatidylserine, or PS, as it is sometimes referred to, is a particularly useful brain nutrient. Phosphatidylserine is efficiently and rapidly absorbed in the intestine, it's taken up into the blood, and readily crosses the blood-brain barrier to reach the nerve cells of the brain. Studies of PS in elderly Alzheimer's patients have shown that it can have a positive influence on memory and cognition and have a stabilizing effect on the daily function of patients with Alzheimer's disease. The way that PS works in the brain has not been determined, but it is thought that PS works by slowing the formation of plaque in the brain. As I mentioned earlier, the onset of cognitive decline begins decades before cognitive loss is actually noted. So the best way to prevent brain deterioration in the future is to help support brain function now. Having said that, utilizing a supportive combination of various brain nutrients working through multiple pathways in the brain can be helpful in enhancing mental clarity, improving memory retention, and creating greater attention and focus. Memory Plus is such a brain health formulation. It contains a combination of nutrients shown to be helpful in supporting the brain, including phosphatidylserine. Or you can obtain phosphatidylserine PS on its own in phosphatidylserine complex. For further information on protecting your brain health, speak with your pharmacist. This is pharmacist and clinical nutritionist John Prexshot bringing you your nutritional notes.